Hi, welcome to the video series on StrokeHub fact sheets. This topic is on atrial fibrillation. The heart pumps blood throughout the body. In normal heart function, the four chambers of the heart beat in a coordinated way to ensure consistent blood flow. However, in atrial fibrillation, also known as AF, this rhythm is disrupted and the heart chambers beat irregularly and rapidly. Here are some atrial fibrillation facts. AF is a common type of abnormal heart rhythm. In Singapore, 1.5% of the population aged 55 years and above have AF. The risk of AF increases with age, from 0.1% in patients under 55 years old to 10% in patients who are 80 years old and above. And AF increases the risk of stroke by 5 times. So how does AF increase the risk of stroke? The irregular pumping of the heart can cause blood clots to form in the heart. Parts of the clots can dislodge and travel to block a vessel in the brain, resulting in stroke. Some people do not experience any symptoms and are unaware of their AF condition until discovered during a medical examination. Those who have symptoms may experience the following: palpitations, breathlessness, chest pain or fatigue, dizziness or lightheadedness. Here are the risk factors for AF. The common ones are high blood pressure, ischemic heart disease, heart valve abnormalities, abnormalities of the heart's pumping function, and sick sinus syndrome. AF is usually diagnosed with a recording of your heart's electrical activity using an electrocardiogram, also known as ECG, or a prolonged heart rhythm monitoring, for example, Holter. Do note that modern IT gadgets which track heart rate or blood pressure may not be able to pick up AF accurately. Therefore, do seek advice from your healthcare professionals. How is AF treated? The aim of treatment is to control the condition and prevent complications. Controlling AF may involve treating your heart rhythm to make it more regular or treating your heart rate to slow it down. Besides the treatment for AF, you may also need treatment to reduce your risk of getting a stroke. Your doctor will discuss the use of blood thinning medications such as anticoagulants to reduce your risk of a stroke. Common anticoagulants that are used for stroke prevention relating to AF includes warfarin and the direct oral anticoagulants commonly referred as DOACs, for example apixaban, rivaroxaban, dabigatran, and endoxaban. Here are some things to note when you're on anticoagulants. Take your medicine daily and follow the dosing instructions. You should receive detailed counseling before taking anticoagulation medication. Do consult your healthcare professionals for advice before taking vitamins, health products, or traditional medicines, as some of this may interfere with the effects of the anticoagulants. And also consult your healthcare professionals before any dental or medical procedures to verify if it is necessary to stop the anticoagulants to prevent any bleeding complications. It is also important to reduce the risk of bleeding. There is a tendency to bleed more easily when on anticoagulants. Therefore, avoid behaviors or activities that may increase the risk of injury or bleeding. Do seek medical attention if you have uncontrolled bleeding or if you experience the following signs of bleeding like persistent nausea, stomach upset, vomiting blood or other material that looks like coffee grounds, have excessive menstrual bleeding or bleeding between menstrual periods, or if you spot any dark red or brown urine, bloody or dark colored stool, or unexplained bruises. Here are some other ways you can reduce your risk of stroke, such as managing your high blood pressure, managing high cholesterol, managing diabetes mellitus, by quitting smoking, eating a healthy diet, stay physically active or start exercising if you are not, attend your follow-up appointments with your doctor regularly, and limit alcohol intake. You can find more topics like this on StrokeHub at www.healthhub.sg/StrokeHub. It is a resource guide for stroke survivors and their caregivers. You may also access these on the Health Hub app. Thanks for listening.